podcasting will be a thrill. Grandpa and chill, grandson and friends. Grandpa and chill in full effect. We talk about it all, yeah, put it all on the set with that pet craze too. We chillin' with Rosie, come through, stay tuned, yeah, listen closely. Cause this the millennials and the silent generation coming together, discussion in rotation. This is Grandpa and Chill.
Hi, I'm Brandon Fox. You're listening to another episode of Grandpa and Chill. I'm here with our amazing producer, as always, Sierra, our amazing co-host, Finus, and my grandfather. Today we have on an amazing guest, Karese LaGuerre. Am I?
LaGuerre.
LaGuerre.
Almost there.
Almost. Yes. If you would tell our audience just a little bit about yourself before we dive in, that'd be awesome.
Absolutely. I am a registered dental hygienist and myofunctional therapist. That is a word that I'm sure is new to 99% of people listening. And so myofunctional therapist is kind of like a personal trainer for all the muscles below your eyes, but above your shoulders. So I work with all the muscles there to strengthen and coordinate them to help people of all ages just live a better life. And I'm sure we'll dive deeper.
Yeah. It's funny, Sierra and I were just talking right before the show about the issues we've been having basically with our jaw and our teeth, and we both grind at night and stuff. And I've actually had jaw surgery before, so I was like so excited for this podcast.
How long ago?
It was arthroscopy about 5 years ago. And I don't know if this is true, but I fell maybe a couple months after the surgery. I was like longboarding and like hit my jaw again. But the arthroscopy did not do that much for me. And like the TMJD is like pretty severe, pretty chronic and stuff, and affects sleep, which I know is also something that you're very into, right? And all that kind of stuff. So yeah.
Yes, absolutely. Yeah, it's all connected, but yeah. Was it like a structural issue that you had with your TMD?
For me, I noticed problems about the age of 18. Like the right side of my jaw just felt weird. Pretty soon after that, it just started clicking. And then pretty soon after that, I couldn't open it without it literally popping out of the socket, and then the chronic pain and all that stuff. And it was just on the right side, and then that affected the left side. And then what happened, I think basically it got worse and worse to lead to the arthroscopy. But I wrestled when I was maybe 16 or 17, and I know I took a lot of face trauma. And I also had a fall, I think, around 18. But it wasn't like, oh, I fell and then all of a sudden it was messed up. It was like I fell, and then way later I started having problems. So.
Okay. Yeah, it's usually a buildup of things, but the trauma certainly didn't help. I mean, the body holds on to a lot of that trauma too in numerous ways. So
yeah,
I'm sure it's affected much more than just the jaw.
Oh, no. Yeah, fingers crossed I'm not too broken, but...
You're not broken at all.
How did you sort of get into this field? What is your sort of big love and specialty, all that kind of stuff?
So I got into this in the way that many people wind up getting into stuff. It really happened through my children. So I'm a mom of 4, and all 4 of my kids had stuff going on. But when it comes to parenting, I think that we all like to give the highlight reel of what's going on. Somebody says, hey, how you doing? How are the children? Great. Everybody's awesome. This one's playing soccer. This one's in dance class, recital next week. And all the highlights that you could possibly give, you're giving. But the reality of it was that, out of the 4 children, my oldest, my son, had a lot of ADHD and behavioral impulse control issues. My oldest daughter, had every sleep issue under the sun. You name it, she struggled with it. Night terrors, sleepwalking, everything. Bedwetting 10 years straight. It was a lot. And then the younger 2 had different sets of issues, but mostly upper respiratory infections with the sore throat and the chronic ear infections. And it was just plaguing my household in numerous ways. But it took a pediatric dentist that I started working for to really connect all the dots for me, because traditional medical systems just did not work in telling me anything was wrong with my children. But it all stemmed back to the way that they were using their muscles, these muscles that I work with now. And the amount of change we've gotten is stupendous. Like, you wouldn't even believe it. So once I started to see some of these changes in my own home and with my own children, it really led me to wanting to make an impact for others. And so it doesn't just stop with children. And children, while I do see a lot of children, I am very passionate about working with adults, because a lot of that stuff, if it's not resolved when you're a child, it only gets worse as you get older. It never gets better.
And do you have specific clients that you work one-on-one with, or is this sort of through the dental practice, or how have you sort of explored this?
So I work one-on-one with all of my clients because everybody presents differently. So it's always a one-on-one thing. It's very difficult to do this in a group setting because everybody's got different muscular issues, right? So I do private practice. I have my own practice. It's called the Myospot, and I work with clients all over the world through teletherapy, doing a lot of virtual work.
Yeah, and you mentioned, like, very funnily, a lot of doctors, even ones that specialize in sort of this area, give either wrong information or don't have all of the correct information. I found that quite a bit. How did you go about learning techniques that worked and sort of figuring out how to help people very specifically here, you know?
You know what's very interesting is that a lot of us, we're so ingrained in the system and the way the system works now that it's very difficult to deviate from that, right? So what I like to say is that if you are an advocate for yourself and you don't take no for an answer, you're going to find yourself a path and a way out, right? So I didn't take no for an answer. I did for a while, but once I started to discover that there were other things going on, you have to go against the system. If somebody's telling you no, the only thing we can do is put a Band-Aid on this. We can't cure it. We can't help it. We can give you some medication and, we can send you on your way. Well, that's not enough. That is not okay. That's not the answer I want. You've got to seek out other options, because a lot of this stuff has been around forever. I mean, even if you're just thinking of various different modalities from ancient Chinese medicine and things that have been around for centuries. When I'm looking at myofunctional therapy, that's actually been around and was originated in the early 1900s. So this has been around forever, and yet people don't really know. You don't get the awareness of it. But once you start digging through, you discover things, right? So I think that once you become a real advocate for your health, you're going to go around the systems. We're in the information age. There is absolutely nothing that you can't find on the internet. You can find absolutely anything. You just continue to advocate, and you do not stop until you've got your answer. And you feel satisfied about it, honestly.
Yeah. And you also said that it, like my jaw problems, for example, it's probably affecting a lot of other stuff. Like, what do you find that it affects, and how are these things all correlated?
So if we go back to where I really work, right, that area below the eyes but above the shoulders, if we're looking at this area here, what we're really thinking about is the upper respiratory system. And all of this is really just the borders of it, right? So we're looking at our mouth as like the front border of that upper respiratory system. The jaw, especially the mandible, that lower jaw, is going to be part of the sides of that upper respiratory system. We're really looking at what is surrounding the upper respiratory system. So when we have issues with our upper respiratory system, that can lead us into problems with sleep. And that's where we get like sleep apnea. Sleep apnea, and apnea is essentially like a closing of that upper respiratory system. So it's stopping your 10 seconds or more of that blockage being there, so you can't breathe at all. So when we're looking at things like that, problems with sleep, problems with cognitive and neurology issues, mental health becomes affected too, because now we're impeding on sleep and we're not getting the oxygen that we need. Our body is definitely deprived of oxygen in certain ways. So we can go for weeks without food, we can go for days without water, but not any of us can really live much more than a few minutes without air. So we need to optimize the air that we're getting in. And so where I work is in helping to achieve better breathing, better structural health of all the upper respiratory surroundings. That way you're able to breathe and facilitate a better system so you don't have problems with sleep, digestion, breathing, and
Karese,
so forth.
I've had two issues for a long time. One of them since I was a child, and that is I have problems breathing at night, and I've been using nose drops since I was a child. And I'm not certain if the cause of it is the food I'm eating, an allergy, or what kind of bedding I'm on, or whatever. But that's been an issue for me. My breathing passages close down a lot, and that's one issue. And the other issue for me, and I've told our co-hosts and also other audiences, I guess they call it empathetic, and I pick up the brain waves of everything from people to bugs or animals or anything, and the physical manifestation of it is that my jaw, I feel a stress in my jaw. And I don't know whether you've ever had anybody that you know of that experiences that.
Okay, so these are two different things. The first follow-up question, because I have to have follow-up questions, is have you ever seen an ENT, an ear, nose,
Uh,
throat doctor?
Ear, nose, throat. I'm not certain. If I did, it was a long time ago.
Okay. Okay. I would figure you would probably know, because at some point in time they would want to scope and see what's going on. And so when they scope, or I'm talking about an ear, nose, throat doctor, and they scope, they take a long wire of sorts, but it's got a camera on the end, and they stick it up your nose to figure out what's going on. That's how you know if you have a deviated septum, if your adenoids are blocking, if you don't have enough of that nostril space in order to facilitate good nasal breathing. So using nasal sprays and being very good on your nasal hygiene only takes you to a point, right? So again, going back to how our oral cavity is kind of all involved in this, with our roof of our mouth, it's actually the floor of the nose as well. So if you are somebody who's had, and I didn't ask you, but I should have, if you've ever had braces or if you've had extractions and you've had things pulled back, everything is going to impact the floor of the nose, your ability to really facilitate good nasal breathing and sustain that on your own independently. And it's going to impact the amount of volume that you would have in your upper respiratory tract as well. So that, combined with the first stage of sleep, is always everything relaxes, right? All the muscles relax. We're heading towards, we're trying to build towards REM when we are entirely in muscular paralysis. So everything's going to relax. But when you don't have a lot of space there anyway, and then muscles start to relax, all the soft tissue surrounding the upper respiratory tract starts to relax, that's going to impact your breathing. And so a big part of what I do is really toning all those muscles. I hate to use that word tone, but we like to strengthen and get those muscles to sit nice and firm on their own.
Wow, this is so cool. My mind's still blown about the fact that this is the upper respiratory system. I mean, you had me there. And like, I guess I'm also thinking like, why why isn't it more important? Like the way you're describing it, it would seem like people would be, brought it up by now. But also, do you have like a TikTok or anything? Because you're doing like a great job of explaining things. I'm really feel like I'm learning. I
You
don't know.
probably are learning. I do not have a
Now,
TikTok.
you might.
I do
I
not.
think you could do
I
good.
keep hearing I
I'm
should
not. You
do
know what?
that,
You're
but
doing
like,
great. I'm not gonna force you to do it. You're already doing amazing things. Um, but yeah, that's so cool. Okay. I don't think I had any questions right now.
Yeah, it's the generational thing because grandpa's like, "Oh, I can't
thank you.
breathe," and then me, fine, and everybody's like, "Oh, TikTok and
I
Insta, you
don't-
gotta like." Grandpa's still like, "So wait, I can't breathe though." Yeah.
It builds up over time. It definitely does build. So even if it started in youth, I mean, it doesn't get any better unless something is done, some type of intervention is done, right? So when I asked if he saw an ENT would do a surgical intervention, would if something's going on with the nose or a deviated septum, a septoplasty or a turbinate reduction, any number of things an ENT would do that would be more invasive as an option, an ENT would get in there. But if you're looking for like an alternative, a more holistic, natural approach, that would be your myofunctional therapist who would help to work with all of the muscles and to would facilitate trying to open up that way.
Do you find it that the older your clients are, the harder it is to sort of sort out these issues, or et cetera, et cetera?
Absolutely. So, working with kids, you see changes so fast and you see things move and shift. They're so flexible and moldable, and you get a lot of change in them really fast. But with adults, especially when you've had these things go on for years, you're talking, 30, 40, 50, 60 plus years, it's hard to retrain the muscles at that moment in time. I mean, you figure even if you just consider it like personal training and you're trying to get abs and you're, in your 50s, it's going to be much harder than it would have been if you did it in your 20s. So, yes, definitely, absolutely. It is more difficult, but not impossible. Not impossible.
Would you
by
still
far.
recommend this for someone like grandpa, a person in their 80s, to sort of seek out the myofascial and that kind of thing that help?
I would say so, yes. I feel like, you get a lot of resistance from that population because they're like, I've been living with it for so long. I haven't been able to sleep really well or breathe really well, and I've made it this far, so I'll be fine. But, you want to optimize all the time that you have left. And if you're breathing better, you are definitely adding life
Is
to
the
your
word
body.
that
You're
I'm
not
hearing
taking away.
myofacial? Oh, functional, because a friend of mine that's a
Myofunctional,
physical
rather. Sorry.
therapist
Myofunctional.
Yeah.
developed a system called myofacial, and I thought, uh, Karese, you answered one question for me, but you didn't address the other question. Well,
Ah, yes, the fact that you're an empath.
no, the
Have I
question
worked with
was, well,
empaths? Is
if
that the
you have
question?
any idea about it, I if there's, let's say, somebody nervous around me, it could be a mouse or a bug or a human being or whatever. I feel that, and it it I feel it in my jaw, basically. It it it's very strong, and it's like a sense, just like any other sense, and it's a very strong one. And for instance, if somebody's nervous and they come across a path, it could be 50 yards away from me, I can feel the the their brain waves, and it affects my it's almost, I would call it a nervous disorder in my jaw.
Does it radiate in your jaw? Like, do you feel like it's a.
Well, it's a
Describe
nervous
it more
condition.
for
The
me.
jaw, it's a stressful condition. It's why I, let's say, might grind my teeth, or I tense up my jaw in order to fight those uncomfortable brain waves.
Okay, so it's causing you to create overactivity in those muscles because when you're clenching, you're overusing your masseters, or when we're talking about grinding, then we're overusing different sets of muscles. So it's causing
So
you to create and hold
it's an
tension within
uncomfortable
those
feeling. So
muscles.
I do what I can to eliminate that, and I, by my thought process, I can create brain waves to reject that those vibes or those brain waves. I have a way to do that, but it's a lot of effort.
Okay. It sounds like essentially what it is a stress response, like a muscular stress response. And in that way, I mean, it would have to be something that you're working on in multiple modalities. So one, I would definitely say a manual therapist, like how you said you had a friend who does myofascial release, is what I would assume that physical therapist does. But you would have somebody who would work on that with touch to remove some of that tension within the fascial system. I'm certain that if that's happening and it's happening often enough, that those muscles are overdeveloped. So the myofunctional therapy, what I do, we'd be alleviating that tension and reducing the amount of stress you hold within there. But then you would also have to get some sort of psychological approach as well. So that's a good part of what I do, is connecting people and working on teams to
Well,
help
have
facilitate
you
the
had
healing
any experience with
all around.
individuals who have this condition?
Not that specific, but a lot of the people I work with do have overdevelopment or overuse of those muscles. We do help to eliminate bruxism, which is clenching and or grinding.
Sierra and I were just talking. I don't know if you want to like talk about your grinding, Sierra, but like the fact that it happens when we're asleep is like so frustrating, because it's like, well, how am I supposed to control it then? You know?
Yeah,
like,
we were talking about how I just went to the dentist and they told me I was gonna need some kind of like a retainer or something to realign my jaw, because I grind my teeth so much. I guess I've just worn down completely the enamel in a couple of different places, and I
I'm
know I
having a hard
grind my
time
teeth.
hearing you, Sierra. I'm sorry.
Hello, right here. Yeah, but I like my enamels, I guess, is just gone in some places, and I had like, it felt a little different, but I didn't know it was gonna be that. And so yeah, I was just shocked by the fact that like, one, that can happen, that I you know, it's like how do you break a diamond with another diamond? How do you mess up your teeth with another tooth? And I grind I know that I grind my teeth, because I grind my teeth when I'm irritated, I grind my teeth when I'm, you know, stressed, I grind my teeth when I'm, you know, concentrating, I grind my teeth when I'm in pain. But I did not know that people are grinding their teeth in their sleep. And it makes me want to just like turn on like my recorder when I go to bed tonight and be like, what am I doing when I go to sleep? I don't. So yeah, can you like talk more about maybe like grinding, or like where grinding habits maybe come from, if you know? Because I'm really curious.
Absolutely. Absolutely. But I do want to address the fact that you said that it makes you want to, monitor your sleep and figure out what's going on. I think that's incredibly important. Everybody should do that at some point in time. There are so many different sleep trackers and ways to track your sleep, and it's important to know what exactly is going on. That way you can remedy it. Like, you're going to backtrack to figure out where's the source of the issue. So with grinding, one of the suspected hypotheses that I'm very much on board with, when it happens at night, right, when you're sleeping, is that when you are moving your lower jaw forward, your body is facilitating more space for you to get in extra breath through that upper respiratory system. So if you're breathing through your nose, or even if you're breathing through your mouth, you move that lower jaw forward, and you guys can all try it now, because everybody always winds up doing that anyway while I'm explaining it. You take a deep breath in through your nose with your lower jaw jutted forward, and you'll feel it is a deeper breath. You're able to get more air there, because that lower jaw, which is one of the borders of the upper respiratory system, is out of the way more. So when it's happening repeatedly, that's each breath you're taking, your body is doing this thing to help facilitate. So what your dentist probably recommended was like a night guard. And more often than not, the night guard is like putting a Band-Aid on the issue, because it's not going to stop you from doing it. You're still going to grind. You're still going to clench, or whatever is happening. It's just preventing you from doing further damage to your teeth. So what I do on my end is I'm trying to not be the Band-Aid and we work on how we can facilitate having better musculature, that we were not grinding and we're opening the upper respiratory tract in a different way that is not going to be as harmful to the teeth.
Yeah.
So the night guard doesn't like help the joints or whatever.
The night guard doesn't help the joints. No, that's not what it's for. It's really
Oh,
just to protect the teeth. What you may be referencing is a splint. A splint will adjust the way the jaw is sitting. That way, it's putting less force on the actual joint itself. But either way, it's not resolving the issue. So
right.
where
Yeah.
myofunctional comes in with temporomandibular joint disorder is in that if it's muscular in nature, we're helping to balance out the muscles. And so we're working to establish better jaw stability. We're establishing a better pattern so that you're riding on that joint more appropriately. We eliminate that deviation as you're opening or closing. We're eliminating a lot of the instability that exists in that joint
Yeah.
through active muscle training.
Ooh.
The deviation of the. Oh, sorry. Go find.
No, just kind of like the active training. I thought it was gonna be like some headgear, maybe. Um, well, because I had to wear headgear to change my jaw placement. Um, but yeah, I was gonna see what types of form of training. How do you tone? How would you tone? I know everything's different, so I guess for grinding, what would be some remedies, some physical, some therapy for that?
So I like to compare it to like personal training, right? So what we do, first step with me and my programs is always to evaluate and to see where the dysfunction is along the chain. Where is the problem really originating and stemming from? And then we're going to go backwards from there and we're going to start strengthening the muscles that should be engaged and that probably aren't initiating when they should be initiating. And then we're going to coordinate to figure out how these muscles are supposed to be moving, how you should be moving them, how we can get on that joint better. It does take various sets of exercises, right? Because we're talking about isolating certain muscle groups and being able to facilitate different muscle groups moving and activating. So it's like an awareness in neuromuscular training. I don't know how else to describe it other than like you could compare it to personal training, right? So if I'm looking at the arm and I'm like, okay, something's going on with those triceps, then we're going to have to target that and then figure out how you use your triceps in conjunction with the other muscles along the arm to throw a ball. Like, where is that supposed to look? What is that supposed to look like so that it happens more efficiently?
Anybody else I have another question. This is a little off topic. Um,
Oh, go.
what do you what do you know about yawning and what happens with the jaw? And I'm assuming because you need air, right? That's why it's opening up so wide.
That is one of the hypotheses about it is that it's another way to inspire some more air.
Oh,
Yes.
okay.
Same with
Oh,
hiccuping.
really?
Yeah.
Oh,
Yeah. Our body is always trying to keep us alive. That's literally the only goal of the body. Keep us
I should be
alive.
thanking my
So when you
my
talk
body
about
when I
like,
hiccup. Ah.
yes, absolutely. Absolutely.
On that point, just like a personal anecdote or whatever, um, I had terrible allergies and was on like year-round allergy meds and all that stuff. And I also through wrestling as well. I really shouldn't have been wrestling. I was very bad at it, and I messed up a lot of quite a lot of stuff. But I broke my nose pretty badly, and was getting like constant nosebleeds and stuff. And they had to like, sorry guys, but like cauterize the blood and all that stuff, like the, I guess you would say the veins. And um, with everything that happened, I remember going into an ENT, and for a long time I had trouble breathing through my nose. I mean, I still do. And he gave me this it's like a special doctor spray or something up my nose that like opened it up. And I was driving home and I was like breathing through my nose, and I was like, oh my god, I feel so good, like my mood and everything. And then that wore off in like an hour, and it was back to normal. But I was like, man, if I was breathing like that all the time, I feel like like, am I just breathing not enough all the time? It's a crazy thought, but
It's a high possibility, and you wouldn't be alone. So here's a follow-up question. Do you ever do any nasal hygiene? Like, do you ever clean out your nose or routinely just take care of your nose?
so I had a something called Q nasal. So that ENT gave me like a spray where I did it twice a day, and that's sort of like it. That felt like a Band-Aid because I'd do it and it would sort of stop the allergy stuff, and I would get more open nostrils. But maybe I think my mom was like, "Oh, you don't want to be on any medication for life," or so. So I got scared and I went off of it. But I've never even heard the term nose cleaning before, actually, before you just said it.
Oh, really? Well, it's
Yeah.
a phenomenal way to facilitate just keeping a more open nose and to really help those sinuses drain as well. So, a saline rinse, like if you ever see, and this is a more natural way as opposed to like a prescription medication, which would be, more often than not, it's a steroid for those nasal sprays.
Yeah.
So, using a saline rinse, saline is a natural way to clean out the nose and the nasal passages. You spray some up your nose, you blow your nose really, really well. It's able to facilitate more space for you. That way you're able to breathe a little bit better and breathe a little bit
Mm.
easier. It drains the sinuses, and you can get a lot better oxygen intake, because that's really what the nose is for, right? The nose is the best way to be breathing anyway.
Is it
Every
okay
breath
to
that we
breathe
take,
from the mouth?
no, 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 no. Every breath that we take from the nose is a breath that is going to be optimized for the body. So we're going to get the formation of nitric oxide, which is going to help that air bind to the receptors so that it can travel throughout our body with the bloodstream. It's going to filter out all of the allergens or whatever might be in the air that we don't want. Our nose is the only way that we filter that. Any breath that you take through your mouth is not going to do that at all. And it humidifies that air so that it's easy to absorb within our body, right? Because our body is a moist environment. Whereas when you're breathing through your mouth, you're taking moisture away from your body. You think about dry mouth and those sorts of things. The mouth is a gate, or the just warm air passing through the mouth. It's going to dry out the mouth. It's going to dry out that air. It won't filter it. And you won't produce any nitric oxide, so it won't bind to the receptors as well.
Wow. This is freaking me out because I breathe through my mouth. Like well, it's like with the allergies, like when they're good, even then, like I just feel like even now, like taking the breath in through my nose, it's, from the brokenness or whatever, like the hole or whatever, it's so small where it's like, I need to sort of compensate.
And that's okay. There are people who just physiologically, anatomically wise, they cannot take good breaths through their nose. But that's when I would suggest that you do medical intervention. And so that's not it's not the answer a lot of people like to hear. But when there's no space for you to nasal breathe due to enlarged turbinates, deviated septum, like something's broken along the path, something is there, then you get a surgical procedure. You would have surgery somewhere along the nasal passageway to open that space up. That way you can facilitate getting better respiration, because it's everything. How you breathe matters.
Yeah. I really want to try this saline solution now because I've never done that, so maybe that would help a lot even with the deviated septum. Do people get, because I know that I've heard that it's not saline. Saline is just like a normal disinfectant or whatever, right?
Yeah, yeah. Mm-hmm.
Because the sprays and stuff, some people get addicted and they can actually make it worse or whatever. Like the ones where you like, yeah.
That is very true, but you don't want to be on those. You want to just use a regular nasal saline. So it's really like a water salt mixture. Like it's really not anything
Okay.
that you can be addicted to, but it does help to
Great.
cleanse out the passageway. Also, another suggestion might be a neti pot. Has anybody heard of the neti
It's
pot?
like
I have a story
have,
about
but
that.
I used to use the little like squeeze bottle, the neti.
Not the
No,
full pot.
just the
where
neti
you would-
squeeze.
It goes in one nostril, comes
No,
out
but I
the
did
other.
that. I did have to do that with the bottle. It was scary. I was like, wait, so where does it
It's
go?
not the most pleasant feeling, but it's fantastic. It's a wonderful way to clean out your nostrils.
I did the neti pot without looking or reading any directions, so I just put normal bacterial tap water in my nose. I really messed it up. This is another one of these episodes where I'm not coming off too great, but like yeah. Anyway, continue, Sierra.
Yeah, no, I had to. I've tried one of those. It's funny you guys are talking because I've had like kind of like the opposite experience where I've like tried a whole bunch of like over the counter things, and then I've had like just demonic allergies, like year round, constant, and now I have like a prescription nasal spray, but I have tried like the neti bottle and stuff in the past, and it might have just been that I was just too congested to even get anything out of it, but I couldn't do them. It was very scary the first time for several times.
It's not comfy, but it's phenomenal. It's wonderful, and once you get accustomed to it, I think it's great. It's absolutely
I think I also, well, I just had like my mom, and she listens to every episode, so I'm telling you. I got it. I went to the allergist and I like came home and I was like, oh yeah, I got to try this like thing. And I got like it comes in a box with like, the bottle or the pot and like all these instructions on like what to do with it that Brandon didn't read. And so it's like, use distilled water and, make sure the water is this. And then you fill it with this. And this is how you clean it and rinse it and be careful. Blah, blah, blah. And I'm like telling my mom was like, oh my God, that's so scary. You're going to put that in your nose. You're going to stick that up your nose. She's like, oh my gosh, those frighten me, those worry me, because I used to hear about, you hear all these stories about the flesh-eating bacteria in the water, and just really be careful, Sierra. Really just be careful when you do that. And I'm like, okay, well, I got about a month in, and I was like too scared to do it anymore.
Yeah, I think it was less than neti pot and more mom.
It's scary. I don't know why. It's the way that it's worded too, because it's like in the instructions, it's like you've got to rinse your nose with like distilled water, but then it's like, I think you also have to rinse it. You also have to like kind of clean it with the distilled water to like make sure there's no bacteria or anything. And it's like, be careful. Do not expose your nose to the tap water.
I wish I could go back to that day.
I know,
honestly. I'm so serious.
Brandon dropping on his bathroom floor and going,
I've seen these devices advertised on TV recently where I guess it blows fluid up in your nose and will clean it out. Is that what we're talking about?
Yes.
Yep. Up one, out the other.
Yes.
Just straight flush.
Cool.
Yeah. You see cleaning out really well. And then if you want to really optimize the space afterwards, you use a nasal dilator, which is just like these little cones that can just go right in the nostrils and just helps to hold it open. So you get a little bit more space there.
Wow.
Do you leave those in there, or does it leave it?
Yep, you go to sleep just like that.
Oh. My nose is going to look huge.
That's a good thing. We like big noses.
Yeah. I would say that like for me, it was my mom as well was like very like against the steroid stuff, which it did help. I mean, I don't know what your views are on like the steroidal medical sort of sprays and stuff. But if you could talk more about how the myofunctional work helps you with breathing as well, because I'm super interested in the muscles being related to the breath. I mean, I've never thought about it that way before.
Absolutely. Well, you'd be surprised to know that there is a proper way to breathe. Yes, it's through your nose, but it actually starts in the mouth. So our tongue is supposed to rest at the roof of our mouth at all times. So when you're not speaking, you're not drinking, you're not eating, you're not doing anything, your tongue should be up, lightly suctioned against the roof of your mouth.
What?
Now, that suction against the roof of the mouth, that palate, which is like we talked about before, also the floor of the nose, it's going to stimulate that floor of the nose to help you with that nasal breathing, right? So you'll get a deeper, better breath. And it also moves the tongue, which is a very long organ. I consider the tongue an organ because it's comprised of 16 different muscles. but it's going to take that very long tongue that can be all the way down to like C6, to C5 or 6 along our cervical spine. So our tongue is very long. It gets it up and out of that airway as well, right? So myofunctional therapy, where does that play a role in breathing? We're helping to facilitate making sure that you are actually in proper oral resting position so that you are able to breathe and take your best breath that you can. So you're able to sustain that tongue up there. It's going to stimulate your nasal floor. It'll stimulate your vagus nerve. That's where digestion really starts and happens. It really helps your body to regulate your autonomic nervous system, which is that parasympathetic, sympathetic fight or flight system. So it helps significantly in numerous ways. But for breathing specifically, we're getting everything in its place so that you can breathe optimally.
Wow. Now that I heard you bring up the tongue, I did I did see this and I wanted to ask about what is a tongue tie? What is that?
I love that question. Thank you. So, a tongue tie, everybody has a connective piece of tissue that goes from the base of the tongue to the floor of the mouth. Okay. Everybody has one. It is not uncommon to have one. What is uncommon or affects 4 to 10% of the general population is one that is short or restrictive. So it limits the amount of mobility that the tongue has. So it might be connected near the tip of the tongue, which you'll hear about as like an anterior tongue tie, because your tip of your tongue can't do any sort of movements whatsoever independently of the floor of your mouth.
Wow.
Or it could be a little further back and just short, and then your tongue can't get up optimally, it can't extend optimally. I mean, there's so many movements the tongue has. It can't cup, it can't retract, it can't do all these numbers of things because that connective piece of tissue is too tight or restricted.
Wow.
So what do you do about that? One, myofunctional therapy, because like I said, the tongue is like its own organ. So it's got 16 different muscles that innervate it. So if we imagine that, let's say our arm had something tight and restrictive and somebody came along and was like, hey, you've got an arm tie, and they just release it. I mean, would your triceps, biceps be able to facilitate you throwing a ball afterwards? Of course not, because you haven't been able to optimally mobilize these muscles. You haven't used them in XYZ number of years, right? So with the tongue, similar thing. We do the myofunctional therapy to get some of those muscles going, to figure out where the dysfunction is, get them a little strengthened. That way, after you're released, you're able to adequately move and get proper mobility of the tongue.
Is this that little piece where you lift your tongue and you see that little line coming up? Is that the
Yeah.
tongue tie? Yes.
Wow.
Yeah. Oh, I never knew that. And is this something that your kids struggled with that sort of brought you on this journey, or?
Yep, absolutely. So some people discover it when their kids are very little. I did not. It starts with like breastfeeding or an inability to adequately bottle feed, because it can affect the baby either way. My children, my last two, have tongue ties that had to be released, but it was poor breastfeeding that they had, that I didn't even realize we were having poor breastfeeding until years later, when I realized all this other stuff they couldn't do. When it came to like chewing and chewing hard foods, they couldn't do it. When it came to keeping their tongue where it's supposed to be so that they could breathe through their nose and adequately, develop and so forth, they just couldn't do those things. And so, yes, I did experience that in my own home, and it was impactful in a number of ways. But yeah.
And what should you do if you feel like your baby has it? Like, how can you really tell, or,
You would have to go to either a myofunctional therapist or a lactation consultant who is trained and works with infants and would be able to adequately assess that for you. Or you go to a release provider. There are ENTs, oral surgeons, or pediatric or general dentists that do release these ties. So when we're talking about a release procedure, I'm not talking about what they would call that at the hospital, which would be like a little snip. That snip is usually never enough. There's always a very deep component that needs to be considered. And so it's using a laser or a scalpel to really get in there and to release all of the connective tissue that is tight or restricted from the front to the back of the tongue.
Yeah, this is amazing. I feel like this is one of those things that's probably much more common and much more underreported, because I'd never even heard of it, and I feel like many people haven't.
Yeah, you
Yeah.
hit the nail on the head. It is under talked about, underutilized, underdiagnosed. I mean, all of this stuff because we're so stuck in traditional medicine, which would tell us, no, you'll be fine. If you can lick an ice cream cone, you should be fine. But who cares about what function you have for licking an ice cream cone? I care about how you're sleeping, how you're breathing, how you're digesting, how you are regulating your nervous system, how you are,
Mm.
able to sustain these greater functions.
Yeah. It's so weird that we're having this conversation now, or very coincidental, because I was just talking to a coworker who the doctor said we're going to try one more steroid treatment for her breathing, and if that doesn't work, it seems like there's nothing they can do. Like the diagnosis is currently, and I'm not naming anybody specific, but the diagnosis for this person is specifically POTS, and but they don't really know, and she just like the quality of life is just so poor because she feels like she can't breathe, and for years her breath has been so bad, and I know that she hasn't tried any sort of holistic options or whatever, but it's I ran into this as well with my jaw. It's like many people don't know, and many specialists don't know, and especially like people just prescribe medication, and then or like I think I was 19 and he's like, yeah, I mean, we could replace your jaw joint, like we could, like that was like, he was like, we're kind of out of options here. And then you, because you have your own, whether it's the tongue tied or the TMJ or whatever, you like look at forums and you know your body and try and figure out stuff, and it's like I wish I had found this or many other things like so much sooner.
Yeah, I definitely hear that a lot. What I would say is that you can't fix what happened in the past, but like I said earlier, advocating and being your own best advocate. If something doesn't sound right, like even when you said it, it sounded like you didn't even, like that was not a consideration at that point in time. Like, we can replace your jaw joint. Okay, that doesn't sound great. I'll be right back. And then you never go back to that office. Like, at that point, you start looking for, well, what are alternatives? We're in the information age. So anything will lead you down some rabbit hole that would get you to a holistic response in some way, shape, or form. But you got to advocate to get to your best version of health. So if you were looking for a different type of band-aid for the situation, you would find one. If you're looking for relief or something that gets to the root of the problem and you're really working out the muscles and so forth, like how I speak with myofunctional therapy, then I would say you would find that at some moment in time. But you just have to continue to advocate, continue to research, continue to be your own best, I don't know, what do they call it, loudspeaker.
Mm-hmm.
You're going to find
Yeah.
the right solution.
This when you're speaking of holistics, and this makes me also wonder about your son and ADHD and how you did that holistically. Could you go into that at all?
Absolutely. So I think it's very sad with children. ADHD is often misdiagnosed. When we think about ADHD, we have to remember that ADHD, ADD, these are symptoms that are creating the diagnosis. So there's no blood test that you take, no MRI, no CAT scan. Like, there's no way to definitively say, oh, yep, we checked and the genes say it's ADHD, or we checked and the blood work said it's ADHD. It's all symptom based.
Oh wow.
So when we have something that's symptom based, we have to take a look at, well, what other things could these symptoms possibly be? Like, what could be manifesting in this similar way? There's an over 70% researched overlap between the symptoms of sleep disorders in children and ADHD in the way that it presents. 70% overlap. I had no idea, right? So my son, it started really in kindergarten. As soon as he got into school, it started where it was, the teacher can't get him to focus. Ni Hao Kai Lan, I don't know if that's even like a good reference, but they had this thing where, you ever seen sun come through a window and you see all the little like specks in there. So Ni Hao Kai Lan is this show that called it a sun fuzzy. So from then I've always called it a sun fuzzy. So my son would find a sun fuzzy in his kindergarten classroom and he'd be
Oh,
gone.
no.
Like the rest of the day would just be watching that one thing floating in the window, right? And they could not get his attention. So this continued from kindergarten all the way through, like various things, all the way through to fifth grade. And at some point, teacher was like, look, you got to do something. Otherwise, he's not going to make it. Like he will have to repeat fifth grade. And then I don't even know if he'll ever get out of fifth grade. And so we took him to a neurologist, and the neurologist asked us a bunch of questions. We filled out a form. Oh, yep, ADHD. It's symptom based. There was no other way for her to determine ADHD than what I put on the form. So about a year or two later, because I was very resistant to getting him on any sort of medication, and that's the only way to treat that. So about a year or two later, I fall into this world of myofunctional therapy and holistic responses to how you can really address these things. And I start diving into that. And at some point, I go back to the neurologist because we were seeing her every 6 months or something like that. And I said, I had my son have a sleep study and he has sleep apnea. And she said, oh, well, you should have told me he had problems with his sleep because there's a large overlap between sleep and ADHD, and it could have been the sleep all along. Well, ma'am, one, I'm not the doctor. I am the parent, okay? It is not my job. Exactly. It's not my job to come in here and say, okay, well, it's this, 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 and this. It's your job to tell me that. So I think that where we go wrong with a lot of these medical systems is that everybody's so short on time. So this neurologist, I don't think there's any way possible. If I didn't bring it up, she would have never brought it up. She would have just keep giving him the same medications and would have just let him fall through the cracks, just like probably all the other people she's not asking about their sleep. But it's a very real thing, this connection between poor sleep in children and ADHD. And so that's the biggest thing that I think people need to advocate for. Don't accept these symptom-based diagnoses just right off the bat. You can get a sleep study to definitively say, okay, well, there's a sleep issue, or maybe there's not a sleep issue and it is potentially actually ADHD. But you'll never know if all you rely on is just that symptom-based diagnosis with the ADHD.
You sound like an amazing parent. And
Thanks.
Yeah.
I got there eventually.
Yeah.
There was that whole part of the story where he wasn't getting very good help.
Yeah. I always think that I had delayed sleep phase syndrome because it was like I couldn't get up to go to school, and then it was just like, well, he won't go to school, and then it was like then I'd get home and I couldn't sleep until like literally 2 or 4 in the morning, and then it just like, yeah, so I completely feel. What specific things, if you wouldn't mind diving into, your son? Did you work on like the myofunctional sort of, I don't know, training or however you phrase that?
Yeah, so with him, he had a lot of issues with restless sleep. So he had a lot of tossing and turning at night. He did a lot of snoring, occasionally did some grinding, but he didn't have anything that was structurally in the way, right? So a visit with the ENT didn't show that there was anything in the nose blocking it. His dentist, his arch was fine. He didn't have anything impeding. It was just the way he was using those muscles. He was using a lot of mouth breathing at daytime and at night specifically. And so what we did was we really had to work on his lip strength, his cheeks, and really working on, when you see cute cheeks in kids, those puffy little cheeks, those are called flaccid cheeks, like those cheeks that you just want to pinch because they're just so soft and squishy. Those are called flaccid cheeks. Those are great for toddlers, but like by the age of 3, you should have normal, like nice toned cheeks. So we worked on that with him. He had that very much as well. We had to work on his tongue and his tongue posture and getting his tongue up and out of the airway because that was a problem. It was sitting low at rest. So he would have his mouth open and the tongue low. And it really was a lot of muscular strengthening, honestly, to be able to facilitate getting that tongue up and sitting there at rest all times. We had to work on his chewing. We had to work on revising his swallow so that he wasn't having a swallow that pushed the tongue forward instead of a swallow that had the tongue up against the palate, to really help with stimulating that digestion and to reduce the amount of air that he was swallowing when he was digesting too, because he did have some stomach issues that were around at that time too. So we had to work on it in multifacets, but a lot of it was muscle tone and
So
strengthening.
how old is the individual that you're talking about, your child, and how's he doing now?
Oh, he is now 18. He just turned 18 on the 18th of this month. But he is doing phenomenal now. So back when it was fifth grade, we weren't sure if he was going to make it out of fifth grade. He is now in college at 18. He just turned 18, by the way. He finished high school a year early. So this kid that everybody thought was not capable of doing all this stuff was super brilliant and able to finish high school a year before his peers. He's in college now, doing college work and college courses, and just adjusting and juggling that whole balance, because college is not 13th grade. But he's doing much better, because there was a point in time where I didn't even think we'd make it to college. I wasn't sure if we'd get to high school. So I am so proud of where he is now. He sleeps well. We don't have the snoring in the house anymore, which is, that alone I'm thankful for. I sleep much better.
And is this like, how quickly did you see the changes? And is this something that he has to continue to train every day, or he'll lose it, or he's good now?
So when when I'm working with a patient, we're working together. We're working to try to establish habits. I want it to become a habit, a subconscious habit, where your muscle it's just, this is where it goes. So we're patterning how your muscles are actually like moving. We're working on all that. So we worked together for about, I want to say it was about 5 or 6 months that we worked together doing all sorts of exercises. There was some resistance, because it's always difficult when it's the parent working with the child. You know what I'm saying? If he was working with somebody else, he might have got done better and faster. But working with me, I'm on him and he's fighting against it. But about 5 or 6 months that we work together actively on it. And then by the time that I'm starting to see that it is a shift and it's a habit at that point, that's when we start weaning down. And most of my clients are good at the end. Like, we don't have to touch up on anything. You don't have to keep working on stuff. It is now a new subconscious habit.
Wow.
It's amazing.
It is. I was going to ask those same questions, like a story of someone succeeding, but you brought up your son, and then you also brought up the success. Yeah, it's really cool. Let's see. Did we talk about...
I do want to talk more about your book, though. Hey,
Oh, yes.
book. So the book is called Accomplished.
Accomplished.
How
to sleep better, eliminate burnout, and execute goals. It is such a labor of love. I wrote it as a way to try to impact more people, because working one-on-one with people, you're limited in time. I can't work with all the people that need help, and not everybody that needs help can work with me, whether it's a time constraint or financial restraint, or just they unaware that they even need to work with me. So what I did was I put a lot of that knowledge, a lot of my stories of what happened with my son, or even some of my clients that we've found such great success with, how you can really utilize breathing to impact your sleep positively. And then from there, how that can be transferred into increased productivity, really eliminating burnout so that you're feeling better throughout the day. You're not kind of sluggish and relying on some sort of external stimulant to keep you up, whether it be, coffee or, those 5-hour energy shots or whatever. And so it is a big labor of love. That way, everybody can kind of follow that same plan. We talked about nasal hygiene in there. It talks about how you can optimize your sleep by using myofunctional therapy to really facilitate strengthening those muscles, how you can create a plan that would create some consistency in your sleep routine so that you can get and balance your circadian rhythm better. So it's got a wonderful plan in there, and it is, I can't stop saying it, a labor of love, because I am deeply passionate about people, one, being aware that there are other options out there. Sleep is not just limited to what mattress you have, or, don't eat a few hours before bed, or all those tips and tricks that people give you. Sleep can be dynamic just based on how you are breathing alone. It can give you so much life back. And so Accomplish is available on Amazon, and I would highly recommend it. It's a great, fantastic read. I don't add in a whole lot of filler, so it's not like a book full of fluff. I get to the point, I give you the tips, the tricks, and then you take that and you change your life.
And it's really encouraging to hear that you can do this through telemedicine as well. Like, you don't have to actually physically be, I guess you don't make adjustments, right? It's all sort of, it's not hands-on, it's more instructive. Okay.
Yes, it's a lot of instruction.
Yeah. I was super curious about posture and how sort of that habit can affect, like, forward head posture, all that kind of stuff. Do you deal with clients that have those issues?
Absolutely. So forward head posture is another way that your body trying to keep you alive. It's trying to get more space for that airway. So there are some people who sleep in a weird posture, or they might have their chin up. That's a great way to open up your airway. There are some people who are just walking with their head forward. That's opening up your airway. You're getting that mandible away from that upper respiratory system. And so all of these are really coping mechanisms. With the posture, there's always going to be postural changes, especially when we're talking about tongue ties, because we have fascia, which is connective tissue that wraps around all the muscle in our body. But the deepest or the strongest connection we have is our deep line fascia that connects from our tongue all the way down to our toes. And so when you have a tongue tie, that's going to kind of tighten up your whole body. People feel a lot of tension on the upper neck and the upper back and the neck, and they're going to feel a lot of relief as things start to unwind when they get that tongue tie sort of released. But yes, I do work with people with forward head posture, a lot of people who can't sleep without arching up their chin. That way they can get more space there, because it's all about the body keeping us alive. And so I'm trying to help you stay alive, but in a more natural way by just getting all these muscles to do what they're supposed to do, what they were designed to do. And for whatever reason, they're not doing.
Yeah, that's like mind blowing to me, because I sit like this, right? And like I try get the whole spine aligned, but my body itself brings me back into that sort of, and I never knew that had anything to do with breathing itself, like that the body is trying to wow, crazy.
Yeah, we compensate when something is going wrong. The body's not up. Okay, we give up. The body's gonna find a way. And so it becomes a compensation or a different type of pattern where you're deviating from the normal, but in order to keep you alive. And so we're unwinding all of that in myofunctional therapy and helping to facilitate a different way for your body to achieve the same goal of keeping you alive, but without all of the dysfunction.
And it's doing exercises around here so that you don't feel the need to sort of jet the head forward kind of thing.
Exactly. Those exercises and working on the breathing and being able to facilitate having the optimal space in order to do so.
Wow. Thank you. Yeah, that's something I've like not heard, and it makes so much sense. So
It is, yeah. It is.
yeah.
A lot of stuff is clicking. I'm like, wow. That's why I'm just like, my mind's blown about why isn't it a big, like, I don't know. The first time, the reason, like, the fact that I'm hearing this for the first time and going like, wow, it makes so much sense. I'm kind of like,
You're like, damn, that
crazy.
would have been real important, real super helpful like 15 years ago.
In gym
crazy.
class or something. You know?
Yeah. Oh my gosh.
How long did it take you to write your book, and how long has it been out and released?
Okay, so you're not gonna like my answer for how long it took me to write it, but I was deeply passionate on getting it done, and so it only took me about a month. Every day
Wow.
I put
Ooh.
pen to paper and wrote until it was done. So only about a month to put it together.
Wow.
February 2020, I think just before the pandemic. February 2020 or 2021? 2020. February 2020
Wow.
is when it came out.
People don't
Wow.
like that answer because they're jealous.
No, well, that's because she knows all the myofunctional tools. She gets
Yeah.
basically just meditating and writing perfectly.
Right.
Right.
Like,
This was
Wow.
that's wonderful.
It's amazing.
You say you write in the book about how there's mainly two types of obstacles: the personal and the physical. Can you talk about that?
Absolutely. So, physical would be some of the things that we talked about, whether there would be a blockage that you can't really fix on your own. So, there would be something like deviated septum, or those turbinates are enlarged, or you've got enlarged adenoids, or your tonsils are overgrown, and you're having a difficult time physiologically doing what you need to do to facilitate good breathing because it's just not there structurally. The personal are all the things that may have built up or led to why you cannot breathe. So there's a lot of stuff that
mm,
I dive into that deals with cranial nerves or your autonomic nervous system with fight or flight and your body just trying to keep you alive, right? So structurally, when we're talking about forward head posture, it's not something that somebody can do a surgery for and then all of a sudden now your head posture is great. It's something that we've got to get over a personal block that may have led you to this compensation. Whereas the physiological blocks are stuff that, we need some sort of medical intervention in order to achieve and to get to that next step.
Right.
so many hats to be wearing.
See, I thought I was the
Isn't
only one
it?
that had breathing problems.
No.
No, you're not alone at all, Grandpa. Like, there's so many people.
And you said you have. I mean, you have a practice. Is it? It sounds like it's got a good future ahead of it. It's doing great. Is there many practices that practice this, or is this like a one in not very many?
I would say that there aren't enough of us as far as myofunctional therapists. If you were to look and see people who are doing active practices, you're probably going to find on average maybe 10 if you're lucky in each state. And then that number might even be low for certain states where, New York as a state probably has 30 therapists. But if you figure how many people are in New York State versus how many therapists, it's like
Yeah.
there's not
10,000
enough of us.
massage therapists,
And it
10,000,
sounds
like
like yeah.
so many other
It
things.
sounds this is important. I'm sorry. Go
Oh no,
ahead. Go
you
ahead.
go. I'm done. Yeah.
Now just gonna compare it to like a cardiologist or something, or somebody that like. I mean, that it's just as important as an airway. It's your yeah. Interesting.
It's your life source. Yeah, there's not enough of us. No, there's definitely not. Which is another reason why I wrote the book. Like, there just needs to be more awareness. And so, hopefully, there are people who are interested and interested enough, or they read about it and they want to also take the journey that I took to take the coursework and to get certification and to be a myofunctional therapist because it's necessary. There's so many people who need the help and not enough people to actually provide it.
What are some of the negative implications for someone who probably has a lot of these issues and are not aware, or they don't seek out help, or they just I mean, it's really, for me especially, it's really easy to fall back on habits. I mean, I sleep in the exact same position every night. My neck is jutted out, and it's like I want a solution. It's just been so hard, to
So what are the repercussions of not getting help? Is that the question?
yeah, yeah. What have you seen someone that has had these habits
It
for a long
typically
time?
tends to compound over time. So when you have muscular dysfunction, it only will increase over time, and which makes it harder to undo. Like we talked about earlier, how it's difficult treating those older people, not impossible, but it's much harder to do when you're older. I would definitely say that you're going to see all sorts of implications, whether it be your sleep quality and that deteriorates into a sleep disorder, where now you have to use something in order to help you sleep, be it a CPAP or a BiPAP or an oral appliance or something to help facilitate you being able to sleep. Or you're going to see things that will change also as well. So your posture, and we know posture over time, every what is it? Every degree forward is like 10 pounds of extra pressure on the body, and so that's when you wind up with the hunches, and we get all this built up tension that we can't unwind using body work, using a physical therapist or a chiropractor or an osteopath. You can't unwind that because your body will just change its form. You find a lot of mental things that compound as well. So you'll have anxiety that will turn into panic attacks, or you will have things that like really deep rooted depression. There's a lot of connections between anxiety, depression, and breathing. And so just really being able to work on how you are breathing and how you are able to respirate is going to change a lot of stuff neurologically. You're going to be able to have better cognitive function, better reasoning skills, the ability to react. Your reactivity will be, all of this stuff gets compromised over time when we're not breathing well. So over time, it doesn't get any better. It definitely gets worse, and it impacts you in a way that you may or may not be able to fully recover from. Sometimes you just get some relief, but you don't get full recovery.
Could you go back into, you said it can fall into a place where like even massage, all that stuff can't unwind it. What do you mean by that?
Yeah, so when you think about the hunching and the rolled shoulders, right? So sometimes you get into those areas where if I see you trying to sit up a little bit more, where you see the older people who do have what it turns into like a hump or an arch of that upper back,
Yeah.
right? And you can't go
Terrifies
to
me.
enough massage therapists to unwind that. It then becomes your structure. It's then a part of your structure. It's not something that you can massage away or that you can, myofunctional therapy away. It's something that will require, a lot more intervention, probably surgical if you're thinking about like uprighting the spine at that moment in time. But yeah.
Yeah.
And if you get to it soon enough, the myofunctional, so the work around the jaw and the mouth and this area, gets the breathing to a place where the body feels comfortable enough to just align, and then it sort of can stop these problems.
Yes, absolutely. So, what I think I mentioned earlier is that part of what I do is working in teams, right? And so, where I find a lot of, good collaboration is with a manual therapist, so a chiropractor, physical therapist, an osteopath, or somebody who's doing that sort of touch therapy. And then if we're working on the structure and they're working on everything and just releasing things, that collaboratively we get people to a state of whole that is significantly better. You're able to align and upright, and you walk with proper posture and so forth.
Wow. Yeah. It's, making me like really need and want to fix these things as soon as possible, for sure.
Do you ever work with speech therapists at all? With like how when someone's talking, especially with the all the information you have with the tongue.
Absolutely. Speech therapists are critical when it comes to myofunctional therapy. There are two main careers where you're able to, or two main licenses where you're able to get the additional education for myofunctional therapy. It's speech language pathology and registered dental hygienist. So I do work with some speech therapists who are not trained in myofunctional therapy, whether they want to or don't want to, or just happy with our collaborative relationship. I do work with
I'm
them.
starting to I'm starting to connect the dots of why there's such a rarity of you guys because we talked about dreams and the tongue and the teeth and now we're talking about speech therapy, which is a whole different the neuro side. It's a lot of things that you would probably have to know in that gateway area you're talking of, the open airway.
Absolutely.
Hmm.
Absolutely. Oral
Wow.
function is, it's certainly a yes.
It's nuts. You must know a ton.
I know too much of one specific thing. I can't change the oil in my car, you know? Certain things I still don't know.
Has it tried breathing
Right?
right?
I mean, I can clean this exhaust out, I guess.
Oh my
That's
god.
all I got.
Got a CPAP in my back pocket. Yeah, to work out for it.
Karese, I don't know if you already uh, told us about this. I know you've talked about your children's issues, but have you personally had any issues yourself?
Thankfully, no. I'm surrounded by it. My husband, obstructive sleep apnea, several of my children, and tongue ties and so forth. But somehow I wound up being the most functional person in the family.
Ain't
Yeah,
that how it
you
goes?
know, the struggle of a mom.
And how does one, like, I'm sure there are a lot of people that get bad sleep and don't even realize it, or breathe poorly and they don't know. What are the sort of tests or things to look out for?
If you wake up in the morning and you don't feel like you've been sleeping all night, like if you wake up and you don't feel well rested, you're not ready to go for the day, like you're like dragging yourself out of bed, that's a big sign that that sleep was compromised and something happened. If you've been told that you snore, there's probably an issue because snoring is common, but snoring is not normal. So, snoring, if you think about the sound of snoring, it's the sound of air meeting resistance as it's going through the upper respiratory tract. Like it's vibrating off of some sort of muscle that's impeding it from flowing through that upper respiratory tract. So, snoring is definitely not normal in and of itself. I know it's very common, but it's something that is a big telltale sign that you need to have some sort of intervention because we want that air to be able to flow freely through our upper respiratory tract. I would say definitely something like chronic allergies, like what allergies are all year long allergies? Like there's something else going on.
I know.
Never accept that as an answer. Nobody has all year
I
round
know.
allergies.
I was diagnosed with that, and this is all blowing my mind. This is like, because nothing they did really helped very much, and it's like, darn.
Because that wasn't it. But they never
They
want to
just
admit that there is something that they don't know because you go through all that medical school, you go to be a specialist, and then something happens and you don't know what it is. You just keep going. You just got to convince yourself, oh, yep, it's definitely that. I don't know why things aren't working. It's definitely that. But advocate for yourself because some of these answers we just know that they're not right, and if it's not right and it doesn't feel right, seek out solutions.
I'm trying not the best to complain about
Yeah, I'm
capitalism
just
all
so
the time.
mind
But at the
blown.
same
It's
time, I'm
like
like,
everything you're
no,
saying.
no, I'm like, this is capitalism's
It's like
fault.
so emotional.
That's
It's
why I'm
like
doing it.
so, yeah. It's like so. I'm so glad you're on because all this bums
Uh,
me out so much, and it's like,
Oh,
that's good. No, this is good news. This is good news.
exactly.
You're
yeah,
right.
Do
yeah.
your patients actually make office visits?
No. So with COVID, I took my physical, like in person practice and we went all virtual. And then I saw such great results. I'm like, why? Why would we spend money on rent? Why would we spend money to be in person, travel, whatever? Like, especially now, I'm super happy now
yeah.
that I've gotten accustomed to it because the price of gas right now, it's not
I was
okay.
gonna say you don't gotta do that commute no
Exactly.
more at
That is
all.
not
It's
okay.
gone.
So, yeah, I'm seeing a lot of great success in working with people with teletherapy. So, I am all in, completely sold on teletherapy. That is a phenomenal way to add convenience to what is already something that, you know, people weren't expecting. So, now there's convenience to it.
And how long,
Wow. Yeah.
like how many sessions or how long would be normal? Is there any such thing as that with a patient?
Very good question. So on average, the average person is around 13 to 14 visits in order for it to be, you know, good. That really can span anywhere from 10 to 20, honestly, but somewhere right in the middle is where most people land. I will say though that, see, now I had a train of thought. Oh, I will say though that what we're working with when we're talking about these visits is that we're meeting once a week, and or sometimes some people who present with a lot more dysfunction, we'd be meeting once every other week. So that could stretch out, either in its entirety from 4 to 6 months, or it can be double that if we're talking about meeting every other week.
How do you get patients? Are they through referrals, or how do patients come about for you?
Referral, referral, referral. A lot of referrals. There are people who just find me, and when they find me, that is absolutely wonderful. I am more than happy to work with people who just find me, but then I also find them people who would work on the team with us. So like I said, I work with, manual therapists, I work with dentists, I work with physicians or naturopaths, functional medicine doctors, people who are a part of the team so that we can get it and attack it from all ends. That way we're making sure that we are getting to optimal healing and wellness.
I was really curious, outside of trauma, like me stupidly wrestling and I guess genetics, like bad formation of the mouth or tongue tied. What are the causes of these sort of dysfunctions?
So I like to say that it's never just genetics. There's always some other thing at play. And so the concept of epigenetics, which is that nature and nurture, and how that blends is typically how we get to this space, right? So how we get here, it starts from very young, be it a tongue tie or just inefficient breastfeeding or prolonged non-nutritive sucking, being pacifier or thumb sucking, object sucking, anything that is impeding on oral development from the very earliest stages are going to impact going forward. So we talked about those flaccid cheeks, we can talk to and speak to the tongue thrust and that improper swallow. I mean, all that happens very early. You develop a mature swallow around age 1. You're really developing a lot of your oral habits in that early 0 to 3 age range. So when you have a lot of pureed foods, you're not chewing a lot, you're not chewing often or chewing at all, you're eating a bunch of soft or mashed foods. That's going to impact your oral function. You're not breastfeeding, it's impacting your oral function. You're not able to use your tongue appropriately because you have a tie that wasn't released. That's going to impact your oral function. Everything that starts very, very early on has an impact in conjunction with what you were already genetically wired for. So it can make it like severe, or it could just really impact the trajectory and make it suboptimal.
I eat a lot of soft foods because of the whole the TMJ thing. Do you recommend trying to strengthen even with people that have those sort of joint problems?
It would depend. If you were going to do that, I would only do it under, supervision, working with somebody who is going to be monitoring how that is impacting the jaw and the musculature around it.
Like you would sit there and I would like eat a steak that's well done, like really tough. And
people eat in front of me. Yeah, they think it's weird, but in front of me. Yes, we do monitor that and make sure that everything is happening the way that it's supposed to, that you're developing a proper chew pattern, that you're swallowing it appropriately, that it's not putting added pressure on the joint or the synovial fluid within that joint.
What specific, if you could give us an example of like an exercise you would do for someone who, you talked about deviation. I know that's a huge problem that a lot of people have, of the jaw not going up and down correctly. What's a sort of way to alleviate something like that?
A lot of times we slow down the movement and then we gradually we gradually work on how we're grading the jaw. Okay. So jaw grading is the process of how it opens and closes and how we're able to facilitate that in a better way. But one exercise that we would use, it would be something that would be, we call it like a spot bounce or a tongue bounce, where you have your tongue up on the roof of your mouth, just slightly behind the two front teeth. And then you're going to maintain that tongue there. You're going to open and you will close. But on that close and even on the opening, if you have to do it slowly, you do it slowly, because we're going to try to achieve a straight down and a straight up. And then we would do that exercise for about a minute, and we're getting it straight down, straight up. And then this is something that if we're working on it in a session together, let's say this was something that I taught you today in a session, you're working on that at home in between our sessions. So if we're meeting every week, you're doing that every day, several times a day, 2 or 3 times a day, every day. And then when we meet the next week, then we're going to work on the next thing, where maybe we're working on grading it using a different type of motion, or maybe we use something to stabilize it at one height, and then we get to a different height, and then we get to a different height. It's really gradual work that builds upon each other.
I would imagine you have a lot of, not a lot, but some, I know myself can be very lazy with take-home assignments and stuff, and it slows progress and all that kind of.
Yeah.
Yeah.
I really like to liken it to personal training. So you imagine you go to the gym, you sign up to work with a personal trainer, and then you work out with them that one day, and you go sit at home and you know, like Netflix and chill for the rest of the week. Then you come back to the trainer and you expect like, hey, like what's going on? I'm not getting any results. Well, you have to work for it, right? Like just working out with a personal trainer, you know, once a week is not going to get you everything that you want. And so I try to lead with that before we even get to the point where you're investing and working in a program or doing myofunctional therapy. It's a commitment. And so if you want those results, you're going to be doing the exercises. You're going to do and put in the work that it takes in order to get the results that you want. And just know that by the end of it, we get to habituation, or it becomes a subconscious habit. And so you're not doing this forever, but you're committing for several months so that you can get to your good forever.
Yeah, good forever sounds better than the alternative.
Exactly.
Yeah.
Yeah.
Oh, sorry, fine. Yeah.
No, I'm just agreeing.
Yeah. Grandpa, do you think you're gonna get some work done now with all your sleep and breathing problems?
Well, I pretty much live with it, and it's not a constant situation. It depends on.
This is the crux of the whole
back.
podcast. Is this way? Grandpa, we just learned for 2 hours. Nah, I'm good. What were you saying, Grandpa?
I'm just saying that my issue is not exactly the same kind of an issue with this brainwave situation. But I have had, from the time I was a young child, I've had issues with breathing, and I happen to think that it may be partly caused by food allergies.
Have you done anything about that? Have you eliminated some inflammatory foods from your diet, things that would be detrimental to your upper respiratory system?
I eat a lot of snacks every night before I go to bed.
That's a no.
and I really have an allergy to
I've been adding
like
to it,
oils
you know?
and butter and stuff like that, and I eat all that junk, potato chips and chocolate covered peanuts and popcorn and all that.
What do you do when you get clients like Grandpa?
You have to weigh, your discomfort with your pleasure.
Yeah.
I guess is what. Yeah.
Not breathing for them M&M peanuts.
Yeah, I don't think Grandpa would be a very good client.
No, I'm sorry about that.
That's totally fine. That is absolutely okay.
In fact, most of my doctors tell me that.
They put their hands up. They're like, "What is this?"
Yeah, in fact, I had one call me today, and he told me, "Why don't you just wait and see what happens before you come in?"
I hope you're okay, Grandpa.
I'm fine.
Yeah.
Your book is out, obviously.
Yes.
Yeah. And is it a hardcover book or
A paperback book. It's available on Amazon
paperback?
in both paperback and also digital.
Do you have a? Can you put it up to the camera so we can see the cover of it?
Yeah. Can you see that well?
yeah.
There we go.
Oh, that's a nice cover.
Yes, beautiful.
Wow.
Yeah, how
like
to
it.
sleep better,
Eliminate burnout
eliminate burnout,
and
and
execute
execute
goals.
goals.
Yeah.
Yeah.
Great.
So it's not
that's
like a
really
super
nice.
thick, hard to read book. It's
And it's on Amazon, or
yes.
is it on Amazon? I should say.
Yes,
Yeah.
absolutely.
Okay.
For all of our audio
Wonderful.
listeners out there who are not checking the videos, the book cover is beautiful and you're missing out. So hop over. I wanted to ask, what are, for people that are unlike Grandpa who do struggle with these things and are really seeking help, what are some of, I would say, just like distillation of the key points from the book, get them excited about reading it, kind of thing?
Whew. I think
I know it's hard.
yeah, that's a hard one. Like, how would we get Grandpa interested, or what takeaways could he grab from the book? Takeaways, definitely the nasal hygiene stuff. Like, it's important to clean out your nose, clean it out well, clean it out often, like every single day. And then from there, find some way to optimize it, whether it's like a breathe right strip or a nasal dilator, so you're getting something in there or on there to help open up those nostrils, because the breathing is key. And then consistency is another thing that you will find in the book that I speak about a lot. We talk about the importance of routines when it's babies. People can't stop telling you when you have a baby or a toddler or whatever, you got to get them on a routine. You got to get them on, some sort of schedule. That does not end with babies and toddlers. We as adults, in order for our bodies to really regulate our circadian rhythm and for us to really take advantage of optimal sleep, we're going to have to get on some sort of routine. So establish yourself a bedtime routine and be consistent with it. You owe it to yourself to have that consistency. So I think those are two good takeaways from the book that are very easy to implement and won't affect your life too much, Grandpa.
Doesn't daylight saving time screw up your circadian system?
If you let it, yeah.
Did you have a question, Sierra, or something earlier? My bad. I don't mean to call you out.
Yeah, no, I was just wondering, I just wanted to ask you what your favorite part of the book process had been, like writing, publishing, editing, getting to brag about it,
My favorite part was a lot of the writing. I think the writing is very therapeutic for many reasons. I got to relive a lot of the stuff that we went through with my son and really, in a good way, kind of release it. So I put it out in the book, and it's out there, and I speak about it, and it doesn't feel as impactful, because I used to hold on to it as something that was very, in a way, shameful, because what kind of mother am I that he suffered with this for so long? I had no idea. But you can't hold on to those negative thoughts. So however you release it, it's important to release it. So that's what I would say is my favorite part, is being able to release all those things, to write it and to let it go.
Yeah.
Wonderful.
We always do last 10 minutes, like last final thoughts on the show, just like going around and stuff. I'd love to start with Grandpa.
Well, I like the cover on your book, so I may actually read it, because I don't want to pick up a book that's too thick. I like when not too much to. So. But yeah, it's like a great cover, and I'm sure that for people, I think being able to help people with health problems is great. I think it's a great thing. When you're not well or you have other issues, it's important to be able to help people with that.
Yeah, I'm happy to help. I love it. Very passionate about it.
Sierra?
Thank you so much for coming, Karese. I can't wait to check the book out, and folks, stay on top of it, check. Oh my God, I almost closed this window. Oh my God. That's the end of my thought. I'm going to stop touching everything. That's the end of my thought.
Finest.
Final thought. I think that you're doing such a great job informing people, and you have so much. Well, you've informed. I'm trying not to put more on you, but I'm like, people have to learn. Like, you do such a good job of teaching, and people are learning a lot. That's important stuff. So it'd be kind of cool. I guess the book's good enough. I guess you did write a book. Okay.
You really like the TikTok, right?
Right?
But yeah, no, I'm just thinking. I appreciate you being on the show and giving so much good knowledge, and it really stuck with me. So
Yeah.
I appreciate you.
Thank you. You're not the first person to mention the TikTok thing, so don't feel bad about it. I have to really start putting that in. When things start happening and people say things, you have to like take it in.
You're gonna come by here with your big money and go, I was in the business of breathing, but now I'm a
And then I owe you like 5%, right? 'Cause
There you go.
Oh no.
No. I had a question about the friend that I mentioned earlier, someone that I don't know if she's like hesitant about, and you're into a lot of holistic work. I know Myofunctional is not necessarily holistic, but she's seen a lot of doctors and had very little success, and for some reason, I don't know, like reticent to jump into that kind of stuff. What would you say to that? Like, how can I sort of get her to move along to you or whatever?
I would say that you got to keep goals in mind. And so ask what the goal is. If her goal is to get to healing or to establish what the root of the problem is, that's probably almost always going to be going a more holistic or a natural route, because traditional medicine is really about trying to put a band-aid on as many things as possible. It's palliative care, where we're thinking about how can we, get this person in a state of comfort as in opposed to a state of wellness. So we want people to have autonomy over their bodies and to be able to achieve true wellness when you're thinking a more holistic or natural approach, as opposed to, going regular traditional medicine.
Yeah, and making money, right? It's like, so like the more people we talk to, it's like, oh my gosh, like big pharma, and it's insanity.
Yes.
Yeah, that's a whole nother rabbit hole.
You think gas is expensive? Try going to the hospital.
Yeah. I recommend Ubering there. It'll be life-saving. Not even joking, like, if you can. My final thoughts, I mean, there's just so much. Like, I was so excited for this episode specifically because, like, I feel like with chronic pain, it doesn't go away. You sort of just, like, live with it, and then immediately when I get a little bit of relief, I'm like, oh my gosh, I can't believe how I've just been, like, letting this happen or sleeping so poorly for so long. And you said about 5 things that I had never heard that ring so true, like the fact that the forward head posture has to do with me trying to breathe, because it makes so much sense. I had a PT literally, he had to have been 92 or something, like a little younger than grandpa, and he was he would yell at me, he would grab my shoulders and pull them back and be like, sit up straight, and he was a really nice guy. I really liked him, but the work that he did on like my neck and my jaw, like hard massages on the joint itself, and like and it was like all stuff that I felt like weren't working long term, because I would try and sit up straight, and then to this day, like right back down here. And so it's just like I want to start a journey of like myofunctional work, and sort of I'll be hitting you up for sure. But I'm just so grateful to have you on, for real.
Thank you. I've enjoyed definitely being here and sharing, and I am happy to know that it was impactful enough that, each of you got a little bit of a nugget that you're able to take with you so that you can be your best selves. And if I get a final thought, I
Yes,
think my
guest
final
is always
thought
the last.
is
Yeah.
my final thought is 100% to just drill home the idea of advocating for yourself. If you think something's wrong, it doesn't feel right, you're not getting the answers or the solution you want, just like how I said, what's the goal? Do you want to get to the root of the problem, or you want to just take care of it and, put a band-aid on it? You got to think about where your trajectory is leading you. And if you don't feel like something's right, please, please, please advocate for yourself. All roads are possible.
And when you say advocate, standing up to that doctor or finding a different solution, or
Find a different doctor, search all your options. You can enter any number of keywords into Google to find a number of different things. So let's say it's the posture, natural solutions to postural changes, or what impacts my forward head posture, or something that might lead you to a blog post, or it might lead you to something else, which would eventually lead you to something where you're like, oh, there's this random therapy I've never heard of. It's called Myofunctional. What? And, it'll get you to the right solution. But you have to actually put in all the work yourself. You can't rely on traditional medicine to give you the answers that you need.
That's good advice.
where can people find you? Where can they find the book? We'll put everything in the show notes as well, but
you can find the book on Amazon. I think everybody knows how to spell Amazon.com. The book's called Accomplished, How to Sleep Better, Eliminate Burnout, and Execute Goals. You don't have to type all of that in. Just type in Accomplished, or you can type in my name along with it, or, hopefully I gave you guys the link. You can put that into the show notes. You can find me, and I am available for free consultations. You can book that straight from my website. It's themyospot.com. So THEMYOSPOT.com.
amazing.
Or on social media at the Myospot. I'm there too.
And y'all can visit the website and take that self-assessment. It's smack dab in the middle of the homepage. Take that self-assessment. See if you got something myofunctional going on.
Yes. Look at you, Sierra. Did you take the assessment?
I did. I was also surprised, of all the different things that it was, asking, do you experience this? Do you experience this? I think eczema was on the list. And I was like, okay, everything's on here. Yes, I did take it. Very fun, very quick, y'all. Very, very short, brief. She's not asking for, sometimes you try to take a self-assessment and then they try to hold your results until you give them your email and do all this different stuff. It's not. It's super quick, fast. Doesn't take any of. They don't want any. She don't want any of your information. She's not harvesting anything. Just get on there, see if this is something you should, think about, y'all.
No.
Ooh, thank you.
Thank you so much again. I so appreciate it. The guest last week, the podcast expert, told me to say this, so I will. If you're listening to this show right now and you're enjoying what you're hearing, please subscribe, all that, but just share it with a friend. Tell somebody else. We've been growing really amazingly, and I'm so grateful for everybody that listens. Thank you to Finest. Thank you to Sierra. Karese, thank you so much for coming on. I've loved this episode. Grandpa, I love you. That's our show. See you next week. All right.
Good night, Brandon. I love you, and
Good
enjoy.
night, y'all. Thank you.
Podcasting with Grandpa Bart and Rosie, always on his shoulder. This is Grandpa and Chill.
Grandpa and Chill is brought to you by your hosts, Brandon Fox, Bart Frank, and Finest Jackson. Our producer is Sierra Doss. To watch and listen to full episodes of the show and follow us on social media, visit grandpaandchill.com. That's grandpaandchill.com.